Knock, knock.
Come in.
Hi, my name is Nicole and I'll be your nurse today. May I verify your name and date of birth?
December 30th, 1996.
Perfect. And do you consent to this assessment video?
Yes.
Thank you very much. I'm going to exit, wash my hands, and I'll be right back and we'll start again. Thank you. Okay, Mark, so you verified your name and date of birth. I did just observe your gait. You have a normal gait when you're walking. And so, do you have any allergies? Okay, what are your allergies?
To penicillins.
Okay, what type of reaction do you have when you're exposed to that?
Hives.
Hives? Okay. I do see that you have a penicillin bracelet on to alert your allergies. And so, are you in any pain?
No.
Okay. And I do see here that upon speaking with you, you have normal chest rise and fall. And are you having any difficulty breathing?
No.
Okay, no problem. And so, just to give you an overview of what we'll be doing, I'm going to be completing a head-to-toe assessment. Prior to that, I'm going to go ahead and give us some privacy, okay? Thank you. Now that we do have some privacy again, I'm sorry about that. I'm going to go ahead and complete a head-to-toe assessment. We'll start again from your head. We'll be evaluating nerves, your lymph nodes, your lung evaluation assessment, cardiac mobility, and we'll also evaluate circulatory as well. We've established you don't have any pain. If at any point you have tenderness or any discomfort, please let me know, okay? And so I'm going to go ahead and start then with palpating your head, just visualizing your skull and touching to see if there's any abnormalities, okay? I'm going to come around here. Okay. And so, do you mind moving over just a little bit? Perfect. All right. Are you comfortable?
Yes.
Okay. So I'm going to go ahead and first inspect. I do see here that there is no visual abnormalities that I can see. I'm going to go ahead and feel for any masses, any lesions or abnormalities. The skull's intact, and so I see here. I'm going to go ahead and now that I'm here, I'm going to go ahead and visualize your ear canal. Do you have any tenderness?
No.
Other side here. There's no obstruction, no presence of earwax. Do you have any tenderness there?
Nope.
Perfect. And so I'm going to go ahead and palpate your lymph nodes. So we have the occipital right back here at the back of your neck. We have the pre-auricular, post-auricular lymph node, the subclavicular. We have the submental, the cervical, the supraclavicular, and the thyroid. So upon palpating all of them, I did not feel any of them. Do you mind swallowing? And so upon palpating all of them, I didn't feel that they were present. If they were palpable, then we would further investigate for any possible signs of infection or anything like that. Okay, so I'm going to go ahead and come around again, and we're going to perform, I'm going to assess your cranial nerve number 1, which is the whisper test. Okay? And so, I'm sorry, so that's cranial nerve number 8. Okay. So I'm going to go ahead and have you occlude one of your ears, okay? And I'm going to whisper a word and you'll just repeat it back to me.
Mermaid.
Perfect. And so, so that was cranial nerve number 8. Okay. So I'm going to start now with inspecting the face. I do see that it is symmetrical. I don't see any facial drooping. Looking at your hair, I see that there's proper proper placement in your hair. I don't see any balding or any hair loss. Same with your eyebrows as well, okay, and your eyelashes. And I'm looking at your eyes. Your eyes are clear. I see transparency, and your pupils are. I'm sorry, your iris is like a bluish green. Is that right? Okay, they're really nice. And so I'm gonna go ahead and assess and evaluate your eyes, okay? I'll be flashing a light from side to side, and we'll get that going.
And then I'm gonna have you bring your feet up kind of to yourself, and then towards my
Bring that back again. Okay. So the pupils are equal and round and reactive to light, and so you're gonna focus on this pen light. I'm gonna bring it close to you and far away.
And then I'm just gonna do
Far away. And they're also accommodating to distance as well. Okay. I'm gonna go ahead and have you follow this pen light, and we're assessing the cardinal fields, and that would be cranial nerve 3, 4, and 6. Okay. I was visualizing for any nystagmus, which is involuntary movements, and so I didn't see that, so we're doing good, okay? And so I'm gonna go ahead and have you pull down your eyes here, okay? And so this here, perfect. And I do see that the sclera is white and the conjunctiva is pink and moist. I don't see any dryness or any abnormalities there. Your eyelashes are full, your eyebrows are also full with hair. There's no hair disbursement. I'm going to go ahead and palpate your sinuses, let me know if you have any tenderness, any pain, okay? And so I'm going to go ahead and move that down now to your nose, okay? Thank you. I'm going to use my pen light to see here. Okay, any history of any nasal surgeries, deviated septum? No, I didn't visualize any epistaxis, which is any nosebleeds. And I'm gonna go ahead and have you occlude one nostril. Okay, do you have any difficulty breathing out of one nostril? Okay, let me know what you smell. Okay, other side. Okay, perfect. And so that is assessing the olfactory nerve. And so I'm gonna go ahead now and move down to your mouth, okay? And so I see here that your lips are pink and they're not dry or blue or cyanotic. So if you don't mind opening your mouth for me, okay? The uvula is midline, the mucous membranes are moist and pink. And do you have any dental issues? Any difficulty chewing? Okay, do you mind sticking out your tongue? Perfect, and saying ah, awesome. And so that is assessing for the hypoglossal and the vagus nerve, your gag reflex. And so do you mind sticking out your tongue again and moving it from side to side? Perfect. And so that is the hypoglossal nerve, and that controls the muscle movement to the tongue. I'm sorry. That's a pretty, I know it's been a long day. No problem. So I'm gonna go ahead now and move down to your neck, okay? Prior to that, do you mind clenching your jaw? Perfect. And do you mind opening your jaw? Okay, I didn't notice any clicking. Perfect. And so we'll move down to your neck, okay? Just upon inspection, I don't see any masses or any abnormal pulsations. I'm gonna go ahead and take a listen to your carotid arteries, but this is where we would normally feel. In the event of an emergency, we would check the carotid artery. Okay. All right, perfect. And I'm gonna grab my stethoscope, okay? My stethoscope. All right. And I'll be listening with the bell of my stethoscope to the carotid artery for any signs of bruit. Okay. No evidence of any bruit, and I'll palpate for any thrills, which is vibrations. Okay. Okay, and that was negative for any thrills as well. Okay, so I'm gonna go ahead and move down. Prior to that, since I'm in this area, if you don't mind shrugging your shoulders for me, perfect. And so that is testing the cranial nerve 11, the accessory. And do you mind puffing out your cheeks and smiling and frowning and raising your eyebrows? Okay, perfect. So that tests the cranial nerve 7, which is the facial. Okay, and so I'm also going to kind of have you feel or touch different places of your face. Let me know if you have any difficulty with that, okay? Or what you feel, if it's soft or hard or sharp. Do you feel that?
Yes.
Okay.
Soft.
Soft. And it was equal all around?
Yes.
Okay. And so that is testing your trigeminal nerve, okay, which is 5, okay? All right. So we are gonna go ahead and move down. Okay, we tested your accessory, and moving down here, I'm gonna feel for your brachial arteries. Okay, perfect, and they are present. And moving down here, I'm gonna go ahead and feel for your radial. Okay, and I am gonna go ahead and measure your radial and your radial pulse here for 1 minute. And then got 81 for your radial pulse, okay? Just looking at your skin here, I see that it's pink as perfused, no evidence of any drying. And do you mind lifting your arm for me? I'm gonna check for skin turgor, your skin retracted, which is normal. And I'm gonna go ahead and feel for and take a look at your hands. No evidence of any clubbing or any cyanosis here with your things. I'm gonna assess your capillary refill. So I'm checking to see if there is capillary refill less than 2 seconds, which that is present in both. Okay. Perfect, capillary refill is present. And if you don't mind holding out your arms, you're going to squeeze my hands. Perfect, and that is bilaterally, equally, symmetrically, and just as strong, those two. And so do you mind pressing down? Perfect, and then going up, yes, and then you're just gonna kind of hold them out. Perfect, all right, and so your strengths are equal and just as strong, and these are present, perfect, all right. So moving on, I'm gonna go ahead and listen to your lung sounds, your cardiac, and then we'll move on. I'm gonna go ahead and clean my stethoscope again. All right. Alrighty. Okay. Sorry about that. Thank you for that. Do I have your permission first to
Yes.
listen? Thank you. Okay. So this will be your shirt. And so what I'm listening for prior to that is the bronchial, bronchiovesicular, and the vesicular sounds. Here I'm looking or I'm listening for any adventitious lung sounds. I'm gonna come on this side. Okay. Deep breath for me. Sorry. Thank you. Sorry about that. Deep breath for me. Okay. Deep breath for me. Thank you. And I'm gonna lift your shirt up on the side. Okay. Deep breath. Alright. Deep breath. Alright. Alright. Lung sounds are clear anteriorly. I'm gonna come around and listen to them posteriorly. I'm gonna go ahead and go be in your shirt, okay? Alright. Go ahead and lift your shirt. Take a deep breath from me. Upper and lower lobes posteriorly are clear. No sounds, no signs of any adventitious lung sounds. And I'm gonna go ahead and assess for tactile frontitis. So you're gonna repeat the word 99, okay, for me a couple times,
99,
okay?
99, 99, 99, 99.
Perfect. And that is normal. I did hear the vibrations, which is exactly what I need. And so I'm gonna go ahead and lift your shirt here. You're gonna feel a quick thump, okay? All right. Okay. And since I'm back here, I just wanted to assess the renal arteries for any dull sounds. I went ahead and percussed there. Okay. So I'm gonna move on to my cardiac assessment. Prior to that, do you have any issues with any cardiac problems?
Nope.
Perfect. So I'm gonna go ahead and listen 8 to men, the aortic, pulmonic, herbs, tricuspid, and mitral. And again, do I have your permission to listen under your shirt? Okay. I'm gonna go ahead and clean this since we are assessing a new area. Might be a little cold. So I'll be listening first with the diaphragm, and then I'll be listening with the bell for any murmurs. Okay. And that was aortic, pulmonic. Okay. Perfect. This is herbs point. Beautiful lub dub sound is what I'm hearing, which is exactly normal. Okay, tricuspid. Alright, and I'm gonna lift your shirt. And so we are gonna listen here, the mitral, for 1 minute. I got 88 as your heart rate, okay? So now, with your permission, I'm gonna go ahead and have you lie down. Thank you. And so, we're gonna lift up your shirt. When was your last bowel movement?
Today.
Okay, perfect. And just, upon inspection, there's no scarring, there's no, the contour is flat, it's symmetrical, and there is no presence of any stomas or colostomies or any issues there. So I'm gonna go ahead and start by, we inspected, I'm gonna go ahead and also take listening to your pulse sounds, and we're gonna start in the right lower quadrant. present and they are normal. And since I'm here, I'm gonna go ahead and listen to your abdominal aorta with the bow of my stethoscope for any bruits. And that is negative. Okay. Bowel sounds were normal. And so I'm gonna go ahead and percuss. So you're gonna feel some tapping. Please let me know if you're in any pain or discomfort. Perfect. And they are tympanic and they were normal. Okay. I'm gonna proceed with some light palpation. Any pain, any discomfort? Light palpation was normal, and we would proceed with deep palpation if there was any issues found upon my assessment, which there were not. And so I'm gonna go ahead and assess for the intervertebral cortex right here. Do you have any tenderness? Okay, perfect. All right. And so we listened here. Thank you very much for that. I'm gonna go ahead now and proceed on down with my assessment, okay? All right. And just inspecting your skin, I don't see any presence of any edema, any discoloration in the legs. Do you mind, there we go, bending, perfect. And I'm gonna go ahead and test on the popliteal pulse. Okay, other side. Okay, and so no presence of any edema. And so, and so I'm going to check here the posterior tibialis. Right, and they are present. And do I have your permission to remove your socks? Okay.
Yep.
Sorry. All right. The next pulse are the pedal pulses, which is the dorsalis pedis. Perfect, and they are present. And I'm gonna go ahead and check for a capillary refill, okay? Awesome. Okay. Less than 2, and they are present, they are normal, okay? Do you mind flexing your feet like if you're pressing the gas? Awesome. And if you're braking, perfect. Do you mind lifting this leg? Good. And the other leg? Perfect. Okay. Thank you very much. Okay. Now I'm gonna have you return now to a sitting position. I'm gonna do your vital signs and kind of go from there. Perfect. My stethoscope one more time. Okay, I got 130 over 77. Okay, is that typically your normal?
Yeah.
Okay, all right. And I'm gonna go ahead and I assess your radial pulse, check your temperature here. This will go underneath the tongue. Your blood pressure was normal, by the way. 98.3. respirations as well, and they were at 16, which is also normal, okay, in my previous assessment. All right, any questions for me?
No.
Okay, no problem. So, oh yes, give me 1 second. And I'm gonna go ahead. Oh yes. Oh yes, I'm so sorry. Thank you for that. I knew I was missing one of them. There we go. All right. Oxygenation is at 99, which is normal, and your pulse rate is also within normal limits. Awesome. Do you have any other questions for me?
Nope.
Okay, I am gonna go ahead and lower the bed for you and place your call light within reach, and the doctor is gonna be with you shortly, okay? I'm gonna go ahead and wash my hands. Thank you so much again.